Lavinia has a question about the Healthcare Workforce Resilience Act. Chris, do you want to maybe explain what that is first before you answer?
Sure, yeah. So the HWRA, the Healthcare Workforce Resilience Act, was first introduced into the U.S. Congress a couple of years ago. And, essentially it provided an opportunity for Congress to allocate 40,000 visas, 25,000 nurses, 15,000 doctors, which would have effectively eliminated retrogression for nurses and doctors for at least a little while. It was a one-time shot. Lavina actually has been very instrumental in tweeting and raising awareness for this bill, which is great. And I want to personally thank her for all that she's done. I've certainly been seeing, and she and I have exchanged several messages over the last few months and years. We're now in a new year. After January 1st, the new Congress was sworn in. The HWRA, of which Kinetics AMN is a member, Mike and I are both members. They are working at putting together some legislation. I've seen some text swapped around. My assumption, my sense is that something will be introduced into Congress this summer. Part of the strategy is to get as many people behind the scenes on board so that when we announce the legislation, it can be announced. You may have noticed in the last 30 days or so, since the retrogression kicked in, there's been a lot of news stories, at least in the American press, about the retrogression, raising awareness. We're seeing a lot of interest from, the big hospital systems and the big staffing and recruiting companies. Having said all that, legislation is extremely hard to get passed in America. Immigration legislation is no different, and maybe even on the hard side of hard legislation. But that doesn't mean that we're not going to continue to work very hard at trying to get something passed.
Thank you, Chris. And I also want to thank Lavinia. We've been in touch many, many times over the years, and we really appreciate all your efforts to raise awareness about this particular act and how everybody is hoping for some legislation change.